have 20, don't we, confirmed cases in the UK so far, but that bound to rise. And is that concerning?
Well, it is at first not so much concerning as it is unusual. And I think that is what has people concerned. Normally, we would see sporadic sort of travel-associated cases in Europe and in the UK, but this type of large outbreak is quite unusual. And I think that is why people are a little bit more concerned than they would normally be.
So tell us why it is so unusual. It's spreading in the community, isn't it? That's giving cause for concern.
So basically, normally you would have these 1 or 2 cases, whereas what we are seeing now is human-to-human transmission. So that means that people who have very close contacts with each other, so contacts with bodily fluids, close skin-to-skin contact, that is spreading within the UK. That's what we're seeing right now.
And this is affecting men, is it, primarily, from what we've seen so far?
Well, there seems to be a disproportionate risk among the community of men who have sex with men. We can't at the moment say exactly why that is, but that is certainly what we're seeing in the numbers right now.
Just remind us how monkeypox presents itself and what it can mean for people who get it.
So initially, monkeypox will present with a fever, headaches, sort of backaches, muscle pain, and just generally not feeling quite well. And then you see the typical rash. So I think we've all seen the pictures that UKHSA has shown, and that is then what kind of then scraps over and eventually falls off. So that's how it looks like. And the pictures actually show that on a number of different skin types, which is quite nice so that people can recognize it.
From what we are seeing here at the moment in this country, these are believed to be mild cases, but perhaps no guarantee it will stay that way.
So generally speaking, monkeypox is what we call a self-limiting disease. So people will get it. It will get quite unpleasant, as I think everyone can imagine from those pictures, but then it will sort of run its course. Now, there is what we call a case fatality rate of between 1% and 4% for the West African clade of the virus, which is the clade that we see in the UK right now. However, that is under quite different circumstances from what we have here. So that is in very resource-limited settings.
What is being used to treat it? Is it the smallpox vaccine that we understand? And I suppose that can only have so much of an effect.
So, I mean, we need to differentiate here between treatment and prophylaxis. So treatment for monkeypox is primarily symptomatic and aims to reduce the likelihood of these skin lesions becoming infected by bacteria. In the UK at the moment, the smallpox vaccine is being used as a pre and post exposure prophylaxis. So that means for a very select group of people who have either a very high likelihood to get exposed, so certain healthcare workers, or who have been in confirmed contact with someone who's had monkeypox, they might get offered the smallpox vaccine as a prophylaxis.
And is that a general thing in many countries or just here, given the fact that even today President Biden has come out and expressed his concern about it in America?
Well, at the moment, technically speaking, the smallpox vaccine is a smallpox vaccine. It's not a monkeypox vaccine. So it will be up to each individual country to decide whether they would like to use it off-label for monkeypox. And then even further on, it is up to each individual and their treating physician whether the risk-benefit ratio is good for them, whether it is something that is sensible for them. So we're not talking about a vaccination sort of at population scale here as we did for COVID.
If somebody's got it or fears to have got it, I mean, a rash could be anything, couldn't it? But what should they be doing? Or going to their doctor, getting some kind of advice?
I think contacting a healthcare provider is certainly the advisable option if you think you have it or you think you have been in close contact with someone who has it.
And are people going to have to be put into isolation when they do have it to try to mitigate any risk of it spreading?
Well, that to a certain degree is a question of the jurisdiction and a question to be had sort of from a government point of view, whether that is something that should be mandated. As individuals, it is certainly advisable not to have any close contacts if you have confirmed to have monkeypox.